We're here to confirm that a patient has passed away from complications caused by the measles virus. The child was school-aged and did not reside in Lubbock County. We do want to say our thoughts and prayers are with this family. We've seen about 20 patients who required hospitalization with confirmed measles, as well as a handful of patients who presented to our emergency department but did not require ongoing hospitalization. They've ranged in ages from infants, school-aged children predominantly, and some older children as well. What we see with these patients is really what we see classically with measles. So in general, the clinical presentation of measles is one that has high fever associated with it, and then a constellation of respiratory symptoms, red, watery eyes, significant nasal congestion, and cough are the hallmark symptoms, and then proceeding with a rash. And that rash is pretty characteristic, starts generally on the face and then spreads down the body. One of the questions that I get asked a lot is, why have patients needed to be in the hospital in this situation? And the answer is really because of those respiratory symptoms. Measles is a respiratory virus that causes a viral pneumonia that may necessitate some extra support for those patients. Sure. First of all, measles is a deadly virus, as we just talked about. So measles can be very dangerous. The predominant issues that we talk about, and certainly that have led patients to be admitted to the hospital, are those respiratory issues. And so that is a frequent cause of death. There are also neurologic issues that can happen acutely, encephalitis, swelling of the brain, blindness, other issues along that line that can also be a part of acute measles. And we were confident that we'd eradicated measles from the United States and had really gotten to a point where we just didn't see these kinds of outbreaks happening. Obviously, that has changed over the last 20-something years, and so we do see outbreaks more frequently, but that is related to how much we're vaccinating our population. When we think about vaccine-preventable illnesses, they're only preventable if we have adequate vaccination rates. And as we see those rates start to decline, across the nation, then we'll see more outbreaks.